All right. The disease I chose is called Klinefelter Syndrome. It affects 1 out of every 500 to 1,000 newborn males, and it's a male-only disease. Most often, the syndrome is a result of an extra X chromosome. So instead of like XY, like most males are, it is now XXY. Occasionally, the variations of XXY chromosome count may occur, most common being the XY mosaic, meaning that not all cells are affected this way. It's just a variety of different counts of that XXY chromosome. In this variation, some of the cells in the male's body have that additional X chromosome, and the rest are normal. The percentage of cells will vary case to case, and in some instances, most have enough of the normal functioning XY cells in the testes to allow them to father children. And women who have pregnancies after the age of 35 have a slightly increased chance of having a boy with this syndrome. Some signs and symptoms is males who have this disease can have small and firm testes, a small penis, sparse pubic, armpit, and facial hair. They'll have enlarged breasts or gynecomastia. They'll have a tall stature and abnormal body proportions, so they can have like super long legs and a really short trunk or some variation of that. This disease is associated with an increased risk for breast cancer, a tumor called an extragonadal germ cell tumor, lung disease, varicose veins, and osteoporosis. And men who have the disease are at an increased risk for autoimmune disorders such as lupus, rheumatoid arthritis, and Sjogren's syndrome. I'm sorry, I can't pronounce that at all. Some diagnostic tests used to tell if somebody has this disease is a chromosomal analysis or a karyotype that will be used to confirm it. In the procedure, they'll just take a small blood sample. White blood cells are then separated from it. They mix it with the tissue culture medium, incubate it, and then check for chromosomal abnormalities such as that extra X chromosome. The chromosome analysis looks at like a number of cells, which is at least 20, and which allows for the diagnosis of genetic conditions in both the full and mosaic state. In some of these cases, because they have such a low level, it might be missed. And if it's suspected, like based on the hormone levels or sperm counts or physical characteristics, additional cells can be analyzed from the blood draw. Prognosis of this disease: most men who have it can expect to have a normal and productive life. Early diagnosis in conjunction with educational interventions and medical management is key. They'll also need a strong social support that can optimize the individual's potential in adulthood. Some treatments that can be used are testosterone therapy, and it's used to increase the strength, promote muscular development, grow their body hair, improve their mood and self-esteem, increase energy, and improve concentration. Most men who have this disease are not able to father children, though if that level of XY to XXY is low enough, they can father healthy offspring, but they might need help from an infertility specialist. The current research I saw was mainly about how to try and prevent this altogether, or it's looking how to like increase sperm production to help those men with infertility issues be able to father children. They're studying the sex chromosomes and seeing what makes it attach like that. Some other information. School-age children can be diagnosed if they're referred to a doctor to evaluate learning disabilities, because, again, this disease can cause some learning disabilities. And they can also want to check it out if the male is not progressing through puberty as expected. And then if they had no problems in their younger years, and then all of a sudden now they want to have children, the adult males can come in for infertility and then be diagnosed that way. And that's all I have.